For Body Chemistry Associates and Health Connection Radio, I'm your host, Jay Foster. Today we want to talk about a condition that's affecting most of us and something your doctors may not recognize, and it's called carbohydrate intolerance. Carbohydrate intolerance and refined sugar intolerance means that you don't tolerate carbs well, whether it's refined sugar in candies and pastries and sodas, or if it's carbohydrates in breads, pasta, potatoes, and rice. You may not be tolerating it very well. And some of the symptoms of carbohydrate intolerance are fatigue, weight gain, type 2 diabetes, PCOS, polycystic ovary syndrome, anxiety, depression, mood swings, not learning well with children, memory loss, sleep issues. Quite a few different problems and symptoms can exist when you have a carbohydrate intolerance. Now, most doctors treat this without knowing it with type 2 diabetic medications. Like metformin is the classic old medication for type 2 diabetes, and I will tell you right now, for all the different medications, the newer ones, metformin is the safest. But we don't have a metformin deficiency, so that's not the reason why you have type 2 diabetes. But you might have a chromium deficiency. There's well over 700 articles that say that chromium is essential for normal insulin function, and chromium deficiencies can contribute to hyperinsulin levels, high insulin levels, which can contribute to all the different symptoms we talked about, unstable blood sugar. You produce too much insulin, it drives your blood sugar down. If it gets to a critical level, your brain says it's an emergency because it's going to die if it goes to zero, so it causes a release of adrenaline from the adrenal glands. The adrenaline, the fight or flight hormone, epinephrine, brings the blood sugar back up to the safe level for the brain and the body. And then the emergency's over. But now you got all this adrenaline in your system, which can contribute to panic attacks, anxiety, nervousness, irritability, sleep problems, hyperactivity in kids, heart palpitations, etc. So when the blood sugar drops down, cloudy thinking, short-term memory loss, depression, mood swings, sometimes headaches, fatigue is a big one. And then your body tries to keep you alive with the adrenaline release, and it is anxiety, nervousness, panic attacks, hyperactivity in kids, sleep problems, hot flushes, all the chemistry of adrenaline, not getting to sleep well, or getting to sleep and then waking up in the middle of the night. So what's the treatment? Well, we've had very good success at helping people with carbohydrate intolerance. It doesn't mean you have to avoid carbohydrates forever, but the first month or so, or first few weeks, you may need to really go on a low-carb diet. Low-carb, high-fat, high-protein, kind of like an Atkins diet or a ketogenic diet, will allow your pancreas to rest a bit. And if we have tests in our BodyChem program, we'll know if you need manganese and zinc and selenium and magnesium in addition to chromium and what amount you need them in. And that's the fastest way we've had good success at working with this, which has been for the last 36 years at Body Chemistry. I've been doing this for 41 years. In our BodyChem program, we do trace mineral analysis and toxic metal analysis. We look for magnesium and manganese and zinc and chromium. We see a blood sugar imbalance or an unstable blood sugar profile there in many, many, many cases. And it tells us what to give and when to give it. Without doing our testing, it takes a little bit longer, but you can take higher protein, higher fat, lower carbohydrate, and no sugar. And we also suggest you avoid cow's milk products except for butter and heavy whipping cream. And you can use goat cheese and sheep cheese and things like that. Eating every 2 to 3 hours, a little bite of something with fat and protein in it, and right before bed helps a great deal. In addition to chromium, the other trace minerals are important. B vitamins are important. We can design a whole program just for you, and most people on our programs begin to feel better within just a few weeks' time. Call us to find out about the BodyChem program. We can do you through a local program all throughout Florida and long-distance programs anywhere outside of Florida or outside the United States. The phone numbers to call locally, 305-670-6702, toll-free 1-800-CHEMIST. That's 1-800-243-6478. On the web, 1-800-CHEMIST.com. Ask them about the BodyChem program. For Body Chemistry Associates and Health Connection Radio, this has been Jay Foster, nutritional biochemist and host of Health Connection Radio. We'll be with you again in a future broadcast.